A warm welcome to all our viewers to our series Natural Medicine today. Today we have a very exciting story about a bomb attack on a Kenyan minister who was confined to a wheelchair for 2 years and had very interesting experience with movement expert Karl Müller, who is here today. And he brought before and after videos, so we will see true miracles here. Stay tuned. Hello, dear Karl. Nice that you're here.
Hello, Corina.
A very interesting topic today. I mean, luckily, we rarely have bomb attacks here now. But in this case, a Kenyan minister really had to suffer from one. And so I'm going to ask you straight away, how did it come about that he came to you, and what actually happened?
Yeah, after a bomb attack was carried out on Minister Yusuf Hassan Abdi, from which he was almost the only survivor. There have been a few dozen deaths, though the bomb was under his chair. He was treated by Dr. Andy Goldberg in London and operated over 30 times. Everything was torn before he went into a trance and was still conscious. He could still say, I'd rather die than have my legs amputated, and then they just tried to save what could be saved. Everything was torn to pieces. And he was in a wheelchair for 2 years. You can see him here during an interview on Kenya Citizen TV, where he could only sit. Everything was in casts, and then he had the will to learn to walk again, and practiced it very, very persistently. He was then able to walk again, first with a walker, then with a cane. And because Dr. Andy Goldberg he'd sent a few customers or patients to us before and had good experiences, he thought, fly to Switzerland to see Karl Müller, who has a method where you can learn to walk faster and better. And so he flew to us.
You can also see that he is of a certain age, so he's no longer 20 either. So there, the regeneration processes are much faster, right?
Yeah, he was between 50 and 60 at the time. Of course, regeneration processes are slower with age. But I think the will is much, much more important than age. So with good will, a lot is possible, even at an older age.
We're going to watch a video of how he got to you.
Yeah.
Okay.
Well, he could already walk with a cane, so he already achieved a great deal there. But was not satisfied. He wanted to be able to walk freely again.
So you can really see the stiffness in the joints, right?
Yeah, I then already imagined what we could do. But at first, I thought I'd let him walk on a 5-metre-long mat web on our material. The material is soft, elastic and springy, like a trampoline, and the springy part, this elastic spring, is the crucial factor, because it activates something in the feet. You've created the word foot intelligence. I find it very interesting. And this foot intelligence is used through this soft, elastic, springy material, just like on a trampoline. A potential is created that not only stays in the feet, but via the fascia, via all the stimulators in the fascia, the subloops, reactivate something throughout the body.
And we'll see the proof that this works right away in the next video, because I just found it so fascinating. He's standing with a cane now. He really needs to stabilise himself.
Well, he couldn't walk without a cane.
And now you put him on a mat that's shaky, and now we see here what happens.
The first thing he does, he did that by himself, he puts the cane away. I wouldn't have dared asking him to put the cane down.
Unbelievable.
He puts the cane away. Yeah, because it's about the feet.
Yes, and that's exactly 5 minutes later, isn't it? So you haven't done any therapy now. He's just walking on shaky ground.
Well, we put the mat over it.
Well, that's fascinating for me.
Feet are underestimated. In academic medicine, this foot intelligence, there is strength. Everything is still measurable. It's biomechanics. So strength, mobility, balancing ability, that's already incredibly important. It's not even talked about in academic medicine. You just say, no, you have to walk more. But if someone has a restraint when someone's limping, and nothing changes in the quality of the walk, and if they walk more, they will never be able to get out of this pattern. This pattern is reinforced when someone's limping, and doesn't consciously do anything against it. So no measures against this walk. Then every step you take becomes even more stable. And this limping walk becomes more and more reinforced. You have to change something. What do you have to change? On the feet. The environment of the feet must be changed. So this flat bottom has to go. As you can see here, there needs to be an elastic, springy floor.
What I can always explain to myself with your interviews when we have them, that if I have a stiff shoe with a hard floor, that if everything is connected, all the microorganisms, all the nerve tracts, meridians and organs, then nothing happens because it has such a stagnation. Nothing is stimulated either. And now, of course, if I have a floor like this, where everything is mobilized and every sensor gets the info, move, then it shoots through the body and all micro muscles are activated, which, for example, if you know that the spine runs along the sole of the foot here, and if it starts to move now and isn't stiff in the shoe, all the nerve tracts in the spine will be activated. I found it so fascinating when I was jogging in your shoes. I suddenly felt as if someone was putting me in such a correction. You're suddenly like this. A grand lady, only the dress is missing. And that's really fascinating. It makes sense to watch it now in the video.
Yeah, there are therapy methods for walking or for jogging. There are courses where the leader says what you have to do. So that's what the head does then. If you consciously try to change something, or if you're limping, you say you can't stand on one leg for so long. Stand on one leg for the same length of time, or take the steps of the same length. This then goes down via the intellect. That will never work. It works the moment I do it consciously. But the easiest is just change the floor. You take away the hardness and the flatness of the ground, put something soft, elastic, springy underneath, then I don't have to think about anything anymore. He walks like this. It's completely symmetrical. So not 100% yet, but by now you can't tell anything about him anymore. He walks 100% straight, normal, so without any abnormalities.
And you've now basically developed a shoe that simulates this floor constantly while walking, no matter where I am.
Yeah, I just thought, how can I bring such a mat, such a floor, into my everyday life. Well, an option would be that I keep rolling a mat in front of my feet and walk on it, and then roll it up again at the back and put it again at the front. But then I thought, no, I'm building shoes where this mat is built into the soles, and that works in almost all patients and people.
So you really integrated this mat into the shoe in terms of technology. That's not just air or something, but there really is a technology in the shoe.
Oh, yeah, this is a material that springs elastically, softly. The foot sinks in and springs back. All the energy is returned. It's not. Soft shoes actually do the exact opposite. With a soft shoe, he would limp even more. Although it feels comfortable, that's why people like to wear soft shoes. But of course that spoils the walk even more, and over the years worsens the limp.
So basically the resilience now supports him when he walks stably, which gives him more dynamics and power.
It's the resilience, yeah, right. The softness does the opposite. The softness provides long-term support.
You have to have that too, the resilience.
And then we pushed the mat to the side. And I had to make a small change to the shoe and elevation, because you can see that from the many surgeries through the many surgeries, the left leg, right from our point of view, but his left leg is too short. Became too short due to the operations. And then I gave him an elevation on his left shoe, in addition to this elastic suspension, an increase of 1.5 centimetres, so that he no longer has this sinking to one side. And you see, from left to right is half an hour. No, wait a minute, that's 2 hours. Left to right is 2 hours, but not 2 years. It's 2 hours. He flew back in the morning. He went back to Zurich airport with his private chauffeur, and he left like that. He emailed us. It's a new life for him. He can walk like other people normally again, without a cane. Of course, he's still limping a bit, you can see that. But that's only 2 hours past. But you can see what intelligence is in the feet. If you only give your feet the opportunity to use it. Only the sandy beach does that already.
Unbelievable. How was it then with the whole regeneration process? Did you look at it a bit again with fascia, muscles? Was there something?
Well, that was the job of other people again. He then ordered 6 pairs of shoes again. And he keeps getting shoes because, for him, I almost wanted to say, unfortunately, in many cases, these shoes can do so much that you're so happy and don't do anything anymore. Because what you should, of course, do now, in his case, are scar treatments, because scars do stick together. Scars make you more immobile. And in the course of life, there are scars and adhesions of fascia which promote immobility or prevent mobility. One of the decisive factors for a long-term, free, pain-free walk. But then that's no longer our job. We point out to all people who wear our concept, our shoes, that it is also important to work on mobility, on nutrition. It's so important that the fasciae are not in an overly acidic environment, because over-acidification makes fasciae also stick together. Not only immobility and psychological issues, that also acidifies. But our focus is on the footwear and on the way how to walk in this footwear, in what circumstances.
Now the fascia is in itself an organ of its own, isn't it? With its own microcirculation, blood flow. If I now control the individual fascia via my feet, via the reflex points, then there should be an improvement in blood circulation in the fasciae, and thus to a better removal of the acid, right? Acid-base balance, all that stuff. Actually, I can say it's also a micronutrient booster. If I wear such shoes, then, accordingly, because all the nutrients get to the places better.
Yeah, of course, these are more the longer-term or medium-term, longer-term effects, of course. It's just the vein pump when I'm on one of those mats, soft, elastic, springy mats, or barefoot in the sand. Then the venous pump is activated much more. And the blood circulation works better, the lymph works better. All waste products from incineration.
The slags.
Yeah, the slags are washed away better. Of course, these are additional side effects. Now, with him, now this short-term effect works immediately. Maybe there's another slide where we have another person who also happens to be a minister. He's a Filipino. He lives in Manila, was a former minister in the Philippines. He heard about us, he flew to us.
Yes, but as you once described to me, when people suffer from pain, you can see how they writhe, and then the whole digestive tract doesn't work so well, does it? You can now see how he bulges, the cervical spine bulges, buckles. Then you have this here.
Well, that's another thing that the walk does, of course. The walk has an influence on the psyche. The psyche has an influence on the walk. You can see on the left, that's how he left. His facial expression too, everything, that affects everything.
You can't say I'm happy or I'm sad. That's how we tilt our heads.
And here we also see the short-term effect. Walking on soft, elastic, springy materials has long-term effects and short-term. And I was allowed to go to the International Fascia Congress and presented a pilot study where we also have proven scientifically that the limp can be immediately improved by 84%. By walking and standing on elastic, springy material. So on our soles, which are made of this material. And here is another example. And you say, of course, he is upright. He's more joie de vivre. Then he wrote me back. He flew back to Manila via Amsterdam. When he came, he told me he can only walk 200 meters. And then he has to sit down from the pain. He can't take it anymore. And he walked around Amsterdam all afternoon. Yeah.
That's a quality of life that's unbeatable.
Of course, that's exactly it.
What other restrictive operations are there? Or really consequences of operations or accidents where you say, that's also something where we can really help. Hip surgeries or comminuted fractures, recovery stories. Simply that one gets an overview of that again.
You're now addressing something that is unfortunately, the common opinion. And this means if I limp, or if I have pain when walking, then the only way out is surgery. That's the common opinion, and it's held up by some doctors, especially operating doctors. Orthopedists also encourage it, because they don't want to be unemployed either. Now, I don't want to blame anyone, but it's hardly being talked about alternatives. If someone has knee arthrosis, then that is at some point the artificial knee joint that becomes the topic. If someone has cartilage damage in the inner or outer meniscus, then they say, yeah, we can, minimally invasive. We can smooth the cartilage, we can cut the edge of the meniscus a bit. But of course, these are surgeries where the fascial apparatus is destroyed. Even if they are minimally invasive, two places where all the layers of fascia that have to slide, and that's a lot of layers on top of each other, which can no longer slide, because this is where everything is scarred by the layers. And if something could no longer slide, if my skin was completely burned here or blocked, then I can't bend my elbow anymore. Then I can't bend my knee anymore. And then with operations, there are new construction sites where mobility is additionally limited. When mobility is limited, the limp becomes more severe.
If a viewer says, I don't know, I've had a skiing accident and now I have a limp, do they have the opportunity to try it out somewhere and see, does it have any effect on me at all or not? Do you also give opportunities to accompany people in any premises that you can experience that there?
Well, basically, I have to say that there are always alternatives to surgery. Almost always. There are, of course, accidents where maybe the bone must be screwed or shut down until the bone is healed. It may be that if a tendon is torn, an Achilles tendon, that you just have to operate. But there is also the possibility that the Achilles tendon, when the foot's stretched, can be reassembled in such a way that it sticks itself together without the need for invasive surgery. Even with an Achilles tendon, there are possibilities. Now, for ligaments, anterior cruciate ligament, posterior cruciate ligaments, I would never operate. From my point of view, that is a completely... I have to be careful not to use all those words that come to mind. That's not funny, that's body damaging to have cruciate ligament surgery. There are also examples in top-class sport, in skiing, where they didn't operate and then afterwards they took part in the World Cup, right at the front. You have to imagine the strain on your knees at 150 kilometers per hour on these uneven snow slopes in these corners. Unbelievable strain. It is possible without a cruciate ligament, because ligaments are actually not primarily there to take on large loads. Small loads, yeah, but there is information flowing in the ligaments that tells the muscles, the muscle fasciae, when and how to react. Reflexes are controlled there. And if an artificial cruciate ligament or a cruciate ligament is taken from another tendon, then it's not even possible to transfer this information. That is, the operation's meaningless, because the transfer of the information is done by other structures in and around the knee. Again, so it's not necessary, and it also takes much less time. I also had a severe cruciate ligament tear myself, with inner ligament, outer ligament. I didn't operate. I can jump down again from 2-3 meters to the hard ground at almost 70. Everything is possible again. Playing football, skiing, everything that was possible when I was 30 is possible again. Simply because I do mobility exercises and above all walk on elastic springy ground every day. And thereby the strength, mobility, balancing ability of the feet is trained automatically without doing anything. And I keep using the intelligence of the feet in what I do all day.
Super. Great. If you really want to delve deeper into it, maybe see a few exercises or something like that, where are the options?
Excuse me, I forgot you asked about trying it. Everywhere in our Kybun Joya shops, you can try our concept of our shoes, risk-free, for 2 weeks. So you don't have to do an operation. If someone is critical, then I understand that. And I'm also very critical of everything myself. And if you would like to try it out for yourself, yeah, you can. Try it risk-free for 2 weeks. And then you'll see if you're limping, if you have pain in your knees, hips, back, then you can see if it works or not.
Super. Great. Thank you, dear Karl, for being here today and for the impressive pictures. Now, that was really fascinating how you can just put down a cane. So, therefore, best of success in your work.
Thank you, Corina.
See you soon. Dear viewers, I hope you were able to take something away with you. It's fascinating how such techniques then ensure that you really walk more stable, although you have, presumably, a shakier ground. I wish you a wonderful time. Thank you for watching and see you soon. Bye. Tschüss.